Stories inform us to what is possible. Stories influence us to what is needed. And stories inspire us to what could be. Stories happen when people live their life to the fullest. These are the storytellers. Hi, Darren Murphy here. Welcome to Storytellers, the program that gives you the behind the scenes of professions that are very personal, that really fulfill a need, or vocations that are jobs that are a calling that a person can't not do it because it's something that speaks to their heart, or people that have started businesses where they have found a very specific need that wasn't being fulfilled and then they filled it ultimately, optimally. Today, we're interviewing a reconstructive surgeon. In the common parlance, it's called plastic surgeon. I met Dr. Roosevelt Peebles back in the early 90s. I was working in the emergency room at the old General City County Hospital, Nashville, Davidson County. Dr. Peebles availed himself to be on call for those really profound injuries that required a reconstructive surgeon to help out so that the person could then go on and lead a life without looking like a Frankenstein. I often got to work with him on these, assist him just by getting stuff that he would need. And what really touched me about him is, I'll say it this way, regardless of what zip code they came from, or even if they had a zip code, he treated them all the same, very, very well. And he even did one step further. When he got done, he would give them his business card and said, I want you to follow up in my office with me and talk to them about what to do as far as behavior and lifestyle changes so that they would optimally heal. And today he has given up his Saturday morning in order to give us an interview. When he heard what Storytellers was about, young people was one of our audience that might be looking into doing a profession. Of course, I call Dr. Peebles' profession a vocation because it's all consuming. Thank you, Dr. Roosevelt Peebles, for giving us this time. I know you're very, very busy.
Certainly my pleasure to be here, and thank you for coming.
What medical school did you go to?
I went to what was then called Rutgers Medical School in Piscataway, New Jersey. And since then, it's been renamed as Robert Wood Johnson Medical School.
And you chose the specialty reconstructive surgery. Were you prompted to do that because you saw something by another doctor? Or what brought you to choose that specialty?
Well, originally, at that time, before one could be considered for plastic and reconstructive surgical residency, one had to be board certified or board eligible in general surgery. So I did a general surgery residency, complete residency, including a year as a chief resident in general surgery in York, Pennsylvania. And that was a prerequisite to go on into plastic and reconstructive surgical residency and training. As a general surgeon, we did a lot of ablative surgery. By ablative, I mean surgeries that involve removing cancer and debilitating diseases. And as a general surgeon, our primary focus at that time was just generally to remove the cancer or the disease. What happened afterwards, I have to admit, was a more or less secondary concern. Case in point would be women who developed breast cancer. As a general surgeon, our primary focus was to remove the cancer. So we would perform a mastectomy, and we would suture the wound or staple the wound or whatever it was. And at that point, our focus was over. And we felt, and I'll admit it now, we felt at the time that we had done our job, that the case was over, that the cancer was out, you effectively had a cure. But unfortunately, we didn't really think about the aftermath. We didn't think about the sense of deformity and loss that patients, women, suffered, and some men for that matter. And that was something that I recognized early. And for that reason, I wanted to do a reconstructive plastic and reconstructive surgical training. And that's what led to it, essentially.
So you were concerned about that person's quality and emotional life thereafter, and that came to you while you were doing general surgery.
Right, because I think the focus ideally should have been to restore that person to their full health, to their full status prior to the onset of the disease, prior to the deformity. Children with cleft lip, cleft palate, things like that. And these were all interests of mine. And these are the things that pretty much led to me wanting to do this. Burn patients, cancer patients, some skin cancers. The sequelae of some skin cancers can be horrendous. And it's not enough to just simply remove a cancer. You've really not done the patient a service if you remove a cancer from the face, but you leave them with a disfiguring deformity that could otherwise be corrected or improved, or for that matter, maybe an overall improvement better with the patient than they were beforehand. And that's the challenge. And it's been a challenge that I've accepted and I've enjoyed over the past almost 30, coming up on 30 years.
I was once told that the residency in the training program for reconstructive surgery is longer than any other specialty, even longer, and this really made me pause, longer than neurosurgery. Is that true?
Things have changed now, but in the beginning, yes. The length of trainings were comparable. And the reason in part was simply that plastic surgery arose basically from wartime experiences, the trenches of World War I specifically. And, plastic surgeons, many of them were general surgeons, and the specialty arose from that. And it was felt traditionally that a plastic surgeon had to be one who was capable of operating on all, and I emphasize the word all parts of the body, all sexes, whether we were talking head and neck, whether we were talking chest, abdomen, whatever, because you had to have, it was felt at that time that you had to have a knowledge base of all systems, organ system, body systems, to be an adequate reconstructive surgeon.
Whereas the neurosurgeon is just concerned about the brain and the spinal column with the spinal cord.
And I don't want to diminish anything about their training, because those are some very sophisticated, very complex body systems to operate on. And it does indeed require intensive training for neurosurgeons to do what they do, and I have the utmost respect for that.
What can you recall your most challenging or rewarding case that you performed?
That's a good question. I guess looking back over the years, I think the most rewarding case that I've done, I was asked to see a patient from Africa. She was in a village. As per their custom, gasoline trucks would come by on a schedule, I think monthly, and deliver gasoline, kerosene to the village. On one event, the truck came, there was an accident, and there was an explosion. Many people in that village were burned. This patient sustained significant burns to her face and hands, for that matter. And there were no surgeons in the area there who could do the reconstruction. And somehow this patient ended up here in Nashville. Obviously, this patient had no financial means. She had no insurance or anything like that, and she was referred to the plastic surgical clinic at Nashville General Hospital.
That's where you and I first met.
That's right. And so I ended up meeting her, and she had extensive horrific burns of her entire face. And I looked at her, and we kind of connected. And so I took her on as a patient, and she and I went back to the operating room, I guess a total of 3 times, to reconstruct her face, to reconstruct her hands. And the most touching moment that I remember was the day that we removed the dressings from her face. The first time, where I had removed all the scar tissue and reconstructed her face with skin that I had taken from her thighs, from different places, her eyelids and everything. And she saw herself in the mirror. And I have a picture of her holding out her hands, thanking God.
Really?
Yeah. And I never forgot that. These things stick with you. But there have been a lot through the years, but she always comes to mind. So,
Your present practice here in Nashville is titled Phase4. Can you tell us what that stands for and how you came up with that concept?
well, we call it Phase4 because we looked at our practice and what we wanted to do and how we did things here, and we came up with a 4 concept that really we felt defined our practice. Caring for our patients, curing, correcting, and change. All 4 of those components we felt pretty much embodied what we did here. It's not enough to just simply do an operation. We listen to our patients. We want to understand what their concerns are. And within what we can do as medical professionals and give them, consent and what is possible and what may not be possible. We wanted to affect cures. We wanted to affect positive changes that patient would go on and be happy with and perhaps feel better about themselves, or maybe restore function to something that they had lost. And so that's how we came up with that.
You have a number of non-invasive procedures that you do here. Of course, you operate at Centennial and at St. Thomas, but you also have a number of procedures that you do here in your office.
We do. Over the past, I would say at least the past 10 years, plastic surgery has seen almost a paradigm shift now. Originally we were all hospital-based surgeons. But as time has gone on, patients, or what some would call consumers, have requested, what can we do that don't involve the cost or the potential morbidity of surgical procedures, that we don't have to go to hospitals for, that we don't have to have general anesthesia for. We only want to we want to correct specific things, and can we find an alternative to do those things? And so over the past decade or so, there have been many innovations in what we call non-invasive surgery or regenerative procedures. And here at Phase4 we offer several. We do chemical peels, we've done laser treatments, we've done thread lifts, which is a interesting technique where we use special threads with barbs on the threads to actually lift the skin into different positions.
Really?
Much akin to a facelift, but without the potential morbidities or costs of a facelift. And it's a procedure here we do in the office. It takes probably maybe 15 to 30 minutes to do. Part of my interest in chemical peels and skin care came from the fact that at that time I was doing a lot of skin cancer cases. And it's not enough to do skin cancer, remove a skin cancer, and have the patient not make the appropriate changes in the lifestyle after removal of skin cancers, such as sun protection and what to avoid and that sort of thing. So out of that, we naturally progressed into skin care. And so we do offer skin care products and regimens to help address wrinkling and sagging skin. And these are techniques such as microneedling. We also use radio frequency type devices, which have been shown to non-invasively tighten skin. We also offer Sonoma, a technique or an instrumentation which uses light therapy to actually help tighten the skin. And this has all been shown in the laboratory and is an accepted a technique for doing these things. And all of these things are things that we do here in the office with no morbidity. Of course, we do Botox. Botox in and of itself was responsible for a significant decrease nationwide in the number of facelift procedures done in the United States because of what you could do. And surgeons recognized very early that there were indeed limitations to a facelift. And that Botox in many ways actually corrected these things without the morbidity and the cost and the recovery time of a facelift. So there are many things we do, and new things are added pretty much every year. We don't jump on the bandwagon for everything that comes out. We research these things. We test them. We research them. I don't mind saying that I probably personally tested most of the techniques here that we use just to see how they feel and to make sure that our patients could tolerate them and that they actually live up to what we're telling our patients that they do.
For young people that might be thinking of a career in medicine, and this is general medicine, and then I want to get into the more, if they wanted to get into reconstructive, I think you already put a wonderful hook out there. Yeah, you can cure it, but how do you get their optimal benefit out of being a person afterwards? Dr. Peebles, if you were talking to young people, maybe in high school or in the beginning of college, they're just doing electives, and they were influenced by a doctor or some health professional, what would you recommend they do in order to prepare to enter the medicine field?
I think the most important thing, the most valuable thing someone could do in that situation would be to job shadow. And by that, what I mean is find a physician or a dentist or healthcare professional, whatever field of that you have an interest in, and ask them, say, can I follow you around? Can I just see what you do? And I think most physicians, most healthcare professionals would probably welcome it. Not all would. Some are just simply too busy to do it, and that's fine, but I think most would. One thing that I did when I was in high school and the early part of college, I volunteered in hospitals. I volunteered in emergency rooms. I volunteered helping patients around and giving directions and all that. And that was good because it allowed me, it gave me a first-hand look at what happened in hospitals. I saw how patients were. I saw a lot of times I saw their fears, their concerns, and their anxieties. But I think those would be the most important things to do.
Dr. Peebles, when you were coming up for your boards, as I understand it, it's both written and oral boards. Can you tell me about the orals, what a young person might prepare for? Can you tell me something?
Well, I'll tell you, I had for general surgery and plastic surgery, you have to complete boards, obviously, to become board certified in either. And a prerequisite for plastic surgery was that you had to be board certified in general surgery. It's different now, but at that time it was. And I remember my general surgery, at the completion of that training, the first part is you take a written examination in general surgery, and if you pass that, then you're invited to come for your oral examination in general surgery, and that's the final step. And I remember with my general surgery, I was, after I'd passed taking the written exam, I was asked to come to Pittsburgh and sit before a committee where the committee would ask you questions, present cases to you to get an idea of how you thought, ask you how you would manage a case, how you would actually specifically do a case. And I remember when I went to Pittsburgh, I walked in, and one of my examiners was a well-renowned, well-respected surgeon, Hiram Polk, who at that time was the chief of surgery at the University of Kentucky. And his nickname at that time was Hiram and Hiram Polk because his reputation, he was a very strict taskmaster. He tolerated no laziness, no lack of commitment from any of his residents. And in any event, I remember sitting through that examination, answering questions and doing, trying to give an accurate account of my education and training. And I remember the last question that Dr. Polk asked me. He said, Dr. Peebles, how many calories are in a slice of toast? And at that point,
What relevance?
I thought that in my mind's eye. I'm thinking, what does that have to do with anything? But then, and I can't remember now what the answer was, but then I realized that I must have been doing pretty good if that's the final question that he had to come down for me with. And then I remember when I was taking the boards in plastic surgery, that was an ordeal. The plastic surgical process, board certification process, is that you have to be in practice, private independent practice, for 2 years before they'll even consider you to take the boards in the first place. And I had been blessed enough to have trained one of my professors at Georgetown was a gentleman, renowned surgeon Scott Spear, and Scott Spear actually wrote textbooks on breast reconstruction. And while I was at Georgetown, I had the opportunity of working with another renowned surgeon, Bauman Tamorian, who was one of the plastic surgeons responsible for introducing liposuction into the United States, and he made tremendous inroads with bringing that procedure to the United States and perfecting it to the point that it's now one of the most common cosmetic surgical procedures now we do. I remember working with Dr. Tamorian in Maryland one day, and the way we practiced it then is so different than what we practice now. And I remember Dr. Tamorian working, and at that time we pretty much stopped liposuctioning either when we started getting more blood than fat, or when the anesthesiologist ordered us to stop. But Dr. Tamorian was a real pioneer, and that really influenced my life.
You've shared with us some pretty renowned teachers that you went under, but I want to share with the audience, you yourself are a fellow of the American College of Plastic Surgeons. You too are able to teach, aren't you?
I do, and I've enjoyed it. I had formerly taught at the local medical school here, and I still teach. Even though I don't directly interact with medical students and residents now as I used to, I do teach nurses, and I enjoy it.
You had offered me one time to teach me how to suture, and I was so, I'm just kicking myself that I didn't take you up on that way back then. I want you to tell people, young people especially, how much is there a talent involved as opposed to hard work?
That's a good question. The talent would be actually having a heartfelt commitment to help people. If you could call that a talent, I struggle to call that a talent. I think that's an innate something that you have to have. But I think to succeed in not only my specialty, but all the specialties, I think really is at least 90% hard work. I think there's some surgeons who are truly talented that they just have a natural God-given gift, but I think the majority of us, we do what we do because of our commitment to getting the best and taking care of our patients, and a willingness to put in the time and study and work hard.
Put in the time, study, work hard, repetition.
Learn. You won't have successes all the time. You will make mistakes. You will have complications, but you learn from those mistakes and you keep going.
So Dr. Peebles, if someone wanted to look at the before and after pictures of what you've done, where would they go to find that?
I think the easiest way would be to go and visit our website at www.phase4plasticsurgery.com. We're going to be revamping that website soon But I think that's an excellent resource that you can use.
And if someone wanted to get in touch with you to follow up and find out about all that you offer and possibly even make an appointment, how would they do that?
The easiest way is just simply give us a call. Our phone number is 615-320-9300. Also, you can visit us on various social media platforms, Facebook, Instagram, Twitter, and the like.
Thank you again so much for your time.
Thank you so much, Darren. It's been a pleasure.